What's up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for March 27, 2021. An update on incarcerated people, COVID-19 and vaccines. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of Public Health on Call. Today, Stephanie Desmond talks to Chris Byrer and Carolyn Suffren of Johns Hopkins for an update on the plight of incarcerated people during the time of COVID-19, including pregnant women who remain in custody even though they are at significantly higher risk for severe COVID. Let's listen.
Carolyn Suffren and Chris Byrer, thanks so much for joining me.
Happy to be here.
Good to be with you.
So today we're going to talk about COVID and incarceration. We're going to get an update on where we are with that and where vaccines may fit in. Chris, I'd like to start with you. Can you talk to us a little about what the situation is right now with COVID and incarcerated people?
Well, it's really been a tough situation. We thought early on, because of what had happened in Wuhan, that prisons and jails, detention facilities were likely to be very hard hit because there were some of the biggest outbreaks early on in China were in detention facilities. And that, unfortunately, has proven to be the case. And despite many people's hard work and best efforts, the fact is, that this virus is so better fit to indoor transmission, to crowded, dense populations. This is why we also, of course, have seen so much transmission in long-term care facilities, nursing homes, cruise ships, other kinds of closed, crowded facilities. There was every reason to think that this would be a big problem in the U.S. prisons and jails. And of course, Stephanie, you always have to remember that nobody incarcerates more people than the United States, both by proportion and in absolute numbers. So it's 2.3 million people. Mass incarceration is a reality of American life and politics, and of course, it's a disproportionate burden on minority communities, as has COVID been. So all of those factors come together. And unfortunately, what we've seen is really that virtually none of these facilities have succeeded in controlling spread. They've had very high burdens of infection in staff, in inmates, in other people who work in prisons and jails. And if you look now at where some of the largest clusters of COVID cases are, more than half are actually in prisons and jails. So there's no question that it's been a very disproportionate burden, and it's continuing. That's certainly the case in Maryland as well.
So I wanted to ask you, I understand that prison guards have refused vaccination sort of at alarming rates, is what I've seen, and that I haven't really seen incarcerated folks being eligible necessarily for a vaccine. What's the situation with the vaccine?
Well, it's a very important question. It's a very mixed picture. I think we have to remember that we really don't have a national plan. We have state and territorial plans. And prisons, of course, are under very different kinds of jurisdictions. So there are federal prisons, there are state prisons, there are county jails, there are city jails, there's immigration detention, ICE detention. And so there's a lot of variability across those. Now, when vaccines, and of course we have 3 right now that have emergency use authorization, when they're under emergency use authorization, you really can't mandate people to get vaccinated, even if it is an occupational exposure. That's very different when you have full approval because, for example, a health facility like Johns Hopkins can mandate that everybody who works there gets flu vaccine. because of the public health importance and benefits of that. So you can't force the prison guards with an emergency use authorization. It is really unfortunate that there have been relatively high rates of refusal. They're a very at-risk group, and even although there's been a great deal of COVID infection in that population, we're still recommending that people who've had COVID and recovered get vaccinated because the immune response is longer lasting from vaccines than from natural infection. Now, in terms of what's actually happening in terms of inmates and detainees and access to COVID vaccines, we've actually been working with a group of students who covering all 50 states, trying to tease this out and understand it. Again, a lot of variability. It does appear that a number of states have begun immunization. You won't see a lot of this in the press or in the media. There's not a lot of attention to it because many states, while they have recognized that this is a population that really needs vaccine, also understand that while we're in this period of scarcity and the public, there are plenty of people outside of prisons who can't get vaccine, who want it, that it's politically unpopular to do this. And finally, I would say, the other effort that we really put a lot of effort into, and many groups did, was on trying to tackle the issue of decarceration, actually lowering the crowding and lowering the numbers of people in prisons and jails. And that has been, I think, frustratingly slow and hasn't had the impact we want to see. But there have been some real changes, and certainly one of them, for example, here in Baltimore City, was that the state's attorney for the city, Marilyn Mosby, really took the position that, for example, nobody should be being put in jail for unpaid fees, unpaid fines, administrative issues. And that's the kind of thing that you hope will survive after COVID, that might be an innovation we can take forward. Because really, what is the public safety protection issue with having essentially a fee-based system where if you have $200, you go home, and if you don't, you go to jail? I mean, that is, many people would say, unjust and a discrimination against low-income people.
Mm-hmm. Carolyn, I'd like to ask you about a more specific population, and that's pregnant women. And I want to start with, how many pregnant women are behind bars?
Well, it's a very good question, because until recently, we actually had very little information about how many that is, and we still don't have any systematic information. And so my research team recently conducted research with 22 state prison systems, all federal prisons, and 6 jails, including the 5 largest. And we estimated from these data that in 1 year, there are approximately 55,000 admissions of pregnant people to our jails and about 3,000 admissions of pregnant people to our prisons. That is a lot of women. Now, some of those women might be the same people, especially when you're talking about jails. They might be arrested and incarcerated multiple times in their pregnancies, but that's a lot of times that pregnant people are interfacing with jails and prisons. So the reason why we didn't have any systematic information about this before is because this is a population that is so often neglected and marginalized. They're either completely disregarded and just it's thought it couldn't even be possible. Why should we even think about this population? Or they're just assumed to have needs that are interchangeable with men or with non-pregnant incarcerated women. So the fact that we don't really know and have systematic information from all 50 states really signifies how marginalized this group is.
Mm-hmm. And they're at higher risk, correct?
They are, but it took about 6 months. It wasn't until about 6 months into the pandemic that the CDC acknowledged that pregnant and postpartum people are at higher risk of severe illness from COVID. We all suspected that was probably the case because we know pregnant people have a relatively suppressed immune system, and they're at much higher risk of severe illness from influenza and from other infections as well. But until we actually had quantitative data to show that, the CDC and many other organizations and agencies weren't willing to classify pregnant people as a high-risk population. And that had significant impact in the carceral setting as well. Chris has talked about how some prisons and jails have move towards depopulating and releasing especially high-risk populations, those who are at risk, classified as being at risk for more severe illness, such as people who are older adults, people with chronic medical conditions, but pregnant people weren't classified that way. And so many jurisdictions in their efforts to depopulate did not include pregnant people.
So you helped write a statement from the American College of Obstetricians and Gynecologists about what should be done with pregnant women during COVID who are incarcerated. Talk to me about that, please.
Well, it's dual goals or dual strands of efforts. One is focusing on depopulation as a sound public health measure, and that should impact, that should include pregnant and postpartum people as well. I'll talk more about that in a moment. And then the second is for those who must stay in custody or who aren't allowed to leave. The facilities need to implement sound measures that are that protect the health and well-being of the pregnant person and ensure their continued access to comprehensive pregnancy care. So when it comes to depopulation, the statement talks about how reducing the number of people behind bars is a sound public health measure. Chris has talked about this as well. It increases the space available and increases the chances of physical distancing, although it's still quite challenging. It ensures or helps to ensure that people can have access to PPE and hygiene supplies. But it's also, depopulation is also important because of the strain that the pandemic has had on the already strained healthcare systems in prisons and jails. And so people's non-COVID related healthcare needs are often getting sidelined and not adequately addressed. And that is also potentially the case for pregnant people who have time-sensitive and frequent healthcare needs. And so again, thinking about releasing people, pregnant people, or not incarcerating them in the first place ensures that they will be better protected from COVID. In terms of specific measures for those pregnant and postpartum folks who remain in custody, the ACOG statement talks about ensuring that pregnant people continue to have access to full scope pregnancy care. And what that means is not only prenatal care, but it does include prenatal care and ensuring they have access to that, whether through on-site prenatal care or telehealth visits or off-site transports, but also comprehensive access to abortion care, which is a constitutional legal right for incarcerated people, access to care for miscarriage. My team's research showed that we know incarcerated pregnant folks have miscarriages at similar rates to non-incarcerated pregnant women. So ensuring that they have access to that care as well. There are also concerns about, for people who do give birth in custody, about the conditions of their birth. Early on in the pandemic, many hospitals would not allow visitors in hospital rooms. And this is already the case for many birthing people who are incarcerated, that they're restricted from having visitors. But there are some cases where they've been allowed to have, for instance, doula support. But a lot of those programs were shut down because of the pandemic. And so the statement also makes a comment about ensuring safe and respectful birthing environments for these people.
So, and where does the vaccine fall when it comes to pregnant women?
So there has been some debate about how to roll out the vaccine for pregnant and postpartum folks, but the overwhelming consensus is that, and from the evidence that we do have about the technology of the vaccines, is that it is safe for pregnant people and for postpartum people, and the consequences of acquiring COVID when you're pregnant are more significant than the potential risks of the vaccines. And the American College of OBGYNs, along with the Centers for Disease Control and Prevention, do recommend that pregnant people get vaccinated, although it should be a conversation and providers should certainly give informed consent and provide pregnant and postpartum folks with the full information. But especially for pregnant folks who are incarcerated, they should have full access to the vaccine as any incarcerated person, and especially any other high priority population should as well.
Chris, I'm going to give you the last word here. What does the future look like in terms of COVID-19, incarceration, vaccines, et cetera?
Well, I think the first thing to say is, of course, happily, we are having more vaccine and more vaccine access, and the rollout has been impressive, particularly in the last couple of weeks. With the Johnson & Johnson one-shot, one-dose vaccine, that also is going to be a lot simpler to use. Its refrigeration characteristics also make it, much simpler to transport, ship, and store. So that really has the potential to make a big change. There are states where, this has not begun and people are not being protected in prisons and jails, and that really has to change. I would say that with this administration, we may be able to get back to where we were at the end of the Obama administration, which was really the beginning of decarceration as a policy and starting to address mass incarceration. That, of course, was largely reversed by previous administration when Jeff Sessions was Attorney General. But I think that expectation is potentially a real one, and it's going to matter because we still incarcerate way too many of our citizens. Carolyn will know that in many other countries that are, EU member states, the UK, comparable countries to ours, and pregnant women are not incarcerated. It's, just absolutely a counterindication for incarceration. So there's a long way to go on that level of reform, but we have been encouraged by at least some of the states really beginning to address the health and well-being of these folks, and it's been an enormously stressful and difficult time for anybody behind bars and their loved ones in this pandemic. The idea that your loved one is there and it's very, very hard to protect them, and they're facing, the inadequacies of the prison health system. It's really been very, very tough for people.
Chris Speirer and Carolyn Suffren, thanks so much for joining me.
Thank you, Stephanie.
Thanks for having us.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you.